Here's something most men don't know. Prostate cancer is one of the few cancers that can grow silently inside your body for years. And by the time it announces itself clearly, it may already be well past its earliest stage. But that doesn't mean it gives you no warning at all. It does. The problem is those warnings are quiet. They're easy to brush off. They look like things you'd chalk up to getting older, to stress, to drinking too much coffee before bed. And that's exactly why so many men miss them. In this video, we're going to walk through 10 of those early signals, what they are, what's actually happening inside your body when you experience them, and when it becomes time to stop ignoring them and make a phone call. Before we get into the signs, you need to understand what the prostate actually is. Because once you see where it sits and what it does, everything else in this video will make immediate sense. The prostate is a small, walnut-sized gland. It sits just below your bladder, wrapped around the upper portion of the urethra, the tube that carries urine out of your body. Its primary job is reproductive. It produces a fluid that makes up a significant part of semen, helping to protect and transport sperm. Now, here's the key detail. Because the prostate essentially hugs the urethra, any change in its size or structure, whether from a benign condition or something more serious, directly affects how urine flows out of the body. Think of it like a hand around a garden hose. If that hand tightens, the flow changes. If it swells, pressure builds. This anatomical relationship is the reason that almost every early warning sign of prostate trouble shows up not as pain in the prostate itself, but as changes in how you urinate. That's the thread running through most of what we're about to discuss. Now, here's where it gets complicated, and why so many men delay getting checked. Most of the early signs of prostate cancer are not unique to cancer. They overlap significantly with a condition called benign prostatic hyperplasia, or BPH, which is simply a non-cancerous enlargement of the prostate that happens naturally as men age. According to research published in the American Journal of Medicine, by age 60, roughly half of all men have some degree of BPH. By age 85, that number climbs to 90%. So when a man in his 50s starts noticing he's waking up at night to urinate, or his stream isn't what it used to be, his first instinct, and often his doctor's first instinct, is to attribute it to normal aging or BPH. And the majority of the time, that instinct is correct, but not always. The critical point here is this. BPH and early prostate cancer can produce nearly identical symptoms. You cannot tell them apart by feel alone. That is why awareness of these signs matters. Not so you can diagnose yourself, but so you know when to have an actual conversation with a physician. With that clearly on the table, let's go through the 10 signs. If you find yourself getting up once, twice, sometimes 3 or more times during the night to urinate, that pattern has a clinical name, nocturia. And while it has many possible causes, it's also one of the most commonly reported early symptoms in men later diagnosed with prostate issues. The reason ties directly back to what we just covered. When the prostate changes in size or shape, it can create pressure on the bladder, reducing its capacity or triggering a constant sense of fullness, even when the bladder isn't actually full. Disrupted sleep from nocturia is often the very first thing that sends men to a doctor. Don't normalize it just because it's common. This one is perhaps the most mechanically straightforward of the group. If something is compressing or narrowing the urethra, less force gets behind the flow. Men describe it as a trickle, or needing to lean forward to urinate effectively. A study in BJU International found that reduced peak urinary flow rate is one of the more reliable, measurable indicators of lower urinary tract obstruction. Again, this is very frequently BPH. But in some cases, it's the prostate changing for a more serious reason. Either way, it deserves attention. This is called urinary hesitancy on one end and dribbling or post-void dribbling on the other. You stand at the toilet and there's a delay before anything happens. Or you think you're done and it continues in slow, uncontrolled spurts. Both occur because the urethral sphincter and the muscles around the urethra are fighting against abnormal resistance. The signal from your brain says go, but the pathway is partially obstructed. This kind of start-stop pattern is frequently dismissed as just how things are now, but it's worth tracking. You've urinated. You're certain you're done. And within minutes, you feel like you need to go again. This sensation, called urinary retention or residual urine sensation, happens when the bladder cannot fully empty because of outflow resistance at the prostate. The brain reads incomplete emptying as a signal to urinate again, even though there's little left. According to guidelines from the European Association of Urology, persistent post-void residual volume is a clinically significant finding that warrants further evaluation. This is urgency, a sharp, difficult-to-delay sense that you must urinate immediately, regardless of where you are or what you're doing. It's different from simply needing to use the restroom. This is pressure. It's the sensation that if you don't find a bathroom in the next 30 seconds, something bad will happen. This occurs because the bladder, under prolonged stress from obstruction, can become overactive. The muscle thickens, becomes less flexible, and begins firing involuntarily. For men with prostate issues, urgency can appear early and is often one of the more disruptive symptoms in daily life. This one is worth treating carefully because it has many causes: urinary tract infections, sexually transmitted infections, kidney stones, and most of them have nothing to do with the prostate. But in the context of prostate disease, inflammation of the prostate gland itself, known as prostatitis, can produce a burning sensation during urination. In some presentations of prostate cancer, local inflammation of surrounding tissue can trigger similar discomfort. If this symptom appears alongside any of the others on this list, or if it recurs without a clear infectious cause, it should be specifically investigated. Let's be straightforward here. This one is rare as an early sign, but when it occurs, it should never be ignored. Blood in the urine, called hematuria, or blood in the semen, called hematospermia, can have multiple explanations, including infection, trauma, or vascular fragility. However, in a subset of cases, these findings have been associated with prostate pathology. A 2019 analysis in JAMA Oncology noted that even isolated hematuria warrants structured urological evaluation to rule out underlying malignancy. The absence of pain does not make blood in urine less significant. In fact, painless hematuria is considered a red flag in clinical guidelines, precisely because it tends not to alarm patients enough. Early-stage prostate cancer is usually contained within the gland and doesn't cause bone pain. That tends to come later, if the cancer spreads. But dull, persistent discomfort in the perineum, the region between the scrotum and rectum, or low-grade pelvic pressure, can sometimes be associated with prostate pathology even at earlier stages. Men often describe this as a vague, hard-to-locate ache that doesn't follow a clear injury. It's not sharp. It doesn't come and go dramatically. It just sits there. That subtlety is exactly why it gets dismissed. This one requires context. Erectile dysfunction is extraordinarily common and has a wide range of causes: cardiovascular disease, diabetes, psychological stress, medication side effects. It is not a primary early sign of prostate cancer in isolation. However, the prostate gland is anatomically close to the neurovascular bundles that control erectile function. If there is significant local disease or inflammation, This proximity can create secondary effects. Additionally, some men first seek medical evaluation for erectile concerns, and it is during that workup that an incidental PSA elevation, or prostate abnormality, is discovered. The connection isn't direct, but it can be the indirect pathway to an important finding. This one is the most contextual of the group, and it needs to be presented honestly. Fatigue alone is not a meaningful early indicator of prostate cancer. It has thousands of possible explanations. But in the context of a man who is also experiencing multiple urinary symptoms, disturbed sleep from nocturia, and a general sense that something feels off, persistent fatigue that has no clear metabolic or lifestyle explanation becomes worth noting. The body under chronic disease burden, even early disease, often signals through generalized tiredness. It's not a standalone warning sign. It's a supporting piece of a larger picture. So, with all of that in mind, when does this stop being information and start being something you actually act on? The answer depends on a few things. First, persistence. A symptom that appears once or twice and resolves is different from one that's been present for weeks or months. Second, pattern. One symptom alone, particularly a urinary one, is usually benign. Multiple symptoms appearing together, or one symptom that keeps intensifying, changes the calculation. Third, age and family history. Men over 50 are at elevated baseline risk for prostate cancer. Men of African descent have statistically higher incidence rates, as documented in data from the American Cancer Society. And men with a first-degree relative, father, brother, who had prostate cancer, carry roughly double the average risk. The specific test to discuss with your physician is the PSA test, prostate-specific antigen. It's a blood test that measures a protein produced by the prostate. Elevated or rising PSA levels are not diagnostic on their own, but they are a meaningful starting point for further evaluation. Current guidelines from the U.S. Preventive Services Task Force recommend that men between 55 and 69 have an individualized conversation with their doctor about PSA screening, weighing the benefits and limitations. If you're in that window and you haven't had that conversation yet, these symptoms are your reason to start. Here's what this comes down to. Prostate cancer, when detected early, has a 5-year survival rate that exceeds 98%, according to data from the National Cancer Institute's SEER database. That number drops significantly when detection happens after the cancer has spread beyond the gland. The warning signs we've covered today are not guarantees of anything serious. The overwhelming majority of men experiencing these symptoms have BPH, or a urinary tract infection, or simply the normal physiological shifts that come with age. But awareness is not the same as fear. Knowing what to look for and knowing when to bring it to a professional is not paranoia. It's basic, intelligent self-care. These symptoms do not necessarily indicate cancer. Only a qualified healthcare professional with the appropriate clinical tests can determine what's actually happening. What you can do is stop normalizing things that deserve a conversation. A weak stream, a night of broken sleep, a vague pelvic ache. None of these are trivial if they're persistent, and none of them should be quietly endured just because they're common. The prostate doesn't make headlines. It doesn't get the attention other diseases get. But for the men it affects and the families connected to them, early awareness changes everything.